Welcome to On Call with Dr. Anselm and Yoha. Today's episode addresses a topic that is both heartbreaking and deeply important: why babies die. The birth of the baby is meant to be a time of joy, hope, and celebration. Yet for many families around the world, and sometimes even closer to home, that joy is interrupted by loss. Infant mortality remains unacceptably high in many settings, and behind every statistic is a grieving family. The causes of infant death are varied. Some begin with the mother's health before or during pregnancy. Others arise from complications during labor and delivery. Still others are related to conditions affecting the baby after birth. What is especially difficult is that many of these deaths are preventable with proper prenatal care, skilled delivery, early recognition of danger signs, and timely medical intervention. In this episode, we'll explore the major reasons babies die, explain them in clear and respectful terms, and discuss what families, communities, and health systems can do to reduce these tragedies. The goal is not to frighten parents, but to inform, empower, and advocate for better care, better preparation, and better outcomes for our youngest and most vulnerable lives. This is a difficult conversation, but it is a necessary one. And it is a conversation rooted in compassion, hope, and the belief that many infants' deaths can and should be prevented. Let's begin.
Dr. Yoha, what maternal conditions can put a baby's life at risk, even before the baby is born?
There are several maternal conditions that can place both the baby's life and the mother's life at serious risk. In this discussion, I'll focus on some of the more common conditions that obstetricians and pediatricians encounter regularly. One major condition is high blood pressure during pregnancy, including preeclampsia. When a mother's blood pressure is poorly controlled, blood flow to the placenta can be reduced. This means the baby may not receive enough oxygen and nutrients, leading to poor growth, premature delivery, or, in severe cases, stillbirth. Another important condition is gestational diabetes. When blood sugar levels are high during pregnancy, babies may grow larger than normal. After birth, these babies are at risk for dangerously low blood sugar levels. If low blood sugar is not recognized and treated promptly, it can lead to seizures, brain injury, or even death. Prolonged or obstructed labor is another serious risk. When labor goes on too long, or the baby cannot pass through the birth canal, both the mother and baby become exhausted. The baby may be deprived of oxygen, leading to weakness at birth or difficulty breathing, conditions that can be life-threatening without immediate medical care. Maternal infections also play a critical role. Infections such as urinary tract infections, untreated fevers, or other systemic infections during pregnancy can cross the placenta and infect the baby before birth. These infections can cause premature delivery, severe illness in the newborn, or death if not identified and treated early. The encouraging message here is that many of these risks are preventable or manageable. Regular prenatal care, careful monitoring, early detection, and timely treatment during pregnancy make an enormous difference. Surveillance is not just about the mother. It is one of the most powerful ways we protect the baby's life, even before birth.
Could you talk about some conditions in the baby itself that can lead to severe illness or even loss of life?
Yes, some conditions that affect babies originate within the baby itself, often before birth. These conditions can be serious and in some cases life-threatening, especially if they are not recognized early. Some babies inherit severe genetic abnormalities that are incompatible with life or that significantly affect vital organs. Others are born with structural defects, particularly involving the heart, brain, or lungs. For example, certain congenital heart defects can prevent the baby from getting enough oxygenated blood to the body, while brain malformations can interfere with breathing, feeding, or basic neurological function. Prematurity is another major factor. Babies born too early often have underdeveloped lungs and may struggle to breathe on their own. Without adequate respiratory support, these infants can become critically ill very quickly. Advances in neonatal care have dramatically improved survival, but prematurity remains a significant risk. Some newborns also suffer from blood-related conditions. These include severe anemia caused by hemolysis, where red blood cells are destroyed, or incompatibility between the mother's and baby's blood types. In these cases, maternal antibodies can attack the baby's red blood cells, leading to profound anemia, jaundice, heart failure, or death if not treated promptly. The encouraging part of this discussion is that many of these conditions can now be detected before birth. Prenatal ultrasounds, specialized imaging, and genetic testing often identify serious problems early. This early detection allows families and healthcare teams to prepare, ensuring that delivery happens in the right setting, with the right specialists and equipment ready. In advanced healthcare systems, many babies with these conditions survive and go on to live meaningful lives because of timely diagnosis and appropriate intervention. Early identification doesn't just provide information, it saves lives by allowing care to begin at the moment a baby is born.
You mentioned that reduced oxygen, also known as hypoxia, can contribute to or even cause loss of life in the newborn period. How does a lack of oxygen lead to newborn deaths?
Hypoxia is one of the most immediate and dangerous threats to a newborn's life. At birth, a baby must make a rapid transition from receiving oxygen through the placenta to breathing independently. If that transition is delayed or impaired, oxygen cannot reach vital organs such as the brain, heart, kidneys, and lungs. The brain is especially sensitive to oxygen deprivation. Even a few minutes without adequate oxygen can lead to severe injury or death. The heart may weaken, the lungs may fail to function properly, and other organs can begin to shut down. This is why hypoxia is considered a true medical emergency in the newborn period. There are several common causes of hypoxia at birth. One is meconium aspiration, which occurs when a baby inhales stool passed before or during delivery. Thick secretions, mucus, or blood can also block the airway, preventing effective breathing. In some cases, prolonged or difficult labor can reduce oxygen delivery to the baby even before birth. The most important and hopeful part of this discussion is that many cases of newborn hypoxia are preventable and treatable. Simple, timely actions can save lives. Clearing the airway by suctioning the nose and mouth, drying and warming the baby to stimulate breathing, and providing positive pressure ventilation when needed can rapidly restore oxygen levels. Every delivery room, no matter how small or resource limited, should have basic resuscitation equipment readily available. Items such as a bulb suction device and a self-inflating ventilation bag, often called an ambu bag or its equivalent, are inexpensive but absolutely critical. When these tools are available and used promptly by trained personnel, many newborn deaths can be prevented. Without oxygen and without the tools to restore breathing, a newborn can deteriorate within minutes. With preparation, basic equipment, and proper training, those same minutes can mean the difference between life and death.
What role does infection play in newborn mortality and illness during the early days of life?
Infection plays a very significant role in both newborn illness and newborn death. Newborns have immature immune systems, which makes them especially vulnerable to infections, much more so than older children or adults. As a result, infections can progress very quickly and become life-threatening if not recognized and treated early. One important example is Group B Streptococcus, a bacterium carried by some pregnant women without causing symptoms. During labor and delivery, this organism can contaminate the amniotic fluid and infect the baby at birth. If untreated, Group B Streptococcus infection can spread rapidly, leading to sepsis, meningitis, or pneumonia. These conditions can result in death or long-term disabilities, such as hearing loss, developmental delays, or neurological injury. The encouraging news is that this type of infection is largely preventable. Screening mothers late in pregnancy and administering antibiotics during labor when indicated has dramatically reduced Group B Streptococcus-related newborn deaths in many parts of the world. After birth, infections can also enter through improper umbilical cord care. The umbilical stump is a direct pathway into the bloodstream, and poor hygiene can allow bacteria to enter, leading to severe infections. Clean cord care and careful monitoring are critical in the early days of life. Newborns are also vulnerable to other infections such as diarrhea, pneumonia, and, in some regions, malaria. These illnesses may seem mild in older children, but can be devastating in newborns if care is delayed. The key message is that infection is a major but often preventable cause of newborn illness and death. Vigilant hygiene, appropriate prenatal screening, timely medical care, and early treatment save lives. With proper attention and healthcare support, many newborn infections can be avoided or successfully treated, giving babies a healthy start to life.
How do differences between countries affect infant survival? Why do babies have such different chances of living depending on where they're born?
Where a baby is born has an enormous impact on whether that baby survives the newborn period. In resource-rich countries like United States or Japan, about 1 out of every 250 babies dies during infancy. In contrast, in many resource-limited countries, such as Nigeria, the rate can be as high as 1 baby dying out of every 30 newborns. That is a staggering and unacceptable difference. The gap is enormous, and it's important to say clearly, poverty alone does not fully explain it. What often explains these disparities is misplaced priorities. When health systems fail to invest in maternal and newborn care, babies are left unprotected at the most vulnerable moment of their lives. In many settings, hospitals lack basic but life-saving necessities: simple resuscitation equipment, reliable electricity, clean delivery environments, trained staff, and systems to monitor mothers and newborns before, during, and after birth. Without these fundamentals, preventable complications become fatal within minutes or hours. Countries that prioritize maternal health, skilled birth attendants, newborn resuscitation training, infection prevention, and postnatal surveillance dramatically reduce infant mortality. We know what works. The science is clear. The tools are often inexpensive. What's required is commitment and accountability. Babies are not meant to die simply because of where they are born. Yet they do, when health institutions and governments fail to provide the basic infrastructure and care needed to support pregnant women and their newborns. This is not just a medical issue, it is a moral one. When societies invest in mothers and babies, survival improves. When they don't, the youngest lives pay the price.
What can families do to protect mothers and their newborns, especially in poverty-stricken countries such as Nigeria?
Families play a powerful role in protecting both mothers and newborns, even in settings where resources are limited. The first and most important step is early and consistent prenatal care. Women should seek care as soon as pregnancy is recognized and continue regular visits throughout pregnancy. Healthcare providers should screen pregnant women for common but dangerous conditions such as infections, diabetes, and high blood pressure. These problems are often silent, but when detected early, they can be treated or closely monitored to prevent harm to both mother and baby. Families should also make deliberate choices about where delivery takes place. Whenever possible, births should occur in hospitals or health facilities that meet acceptable standards of care. Facilities with trained obstetricians, midwives, pediatricians, or skilled birth attendants, as well as basic equipment for newborn resuscitation and immediate care after birth. The presence of simple tools and trained hands at delivery can mean the difference between life and death. During pregnancy, families should ask for surveillance and monitoring, including ultrasound scans, blood tests, and regular assessments of the baby's growth and well-being. These evaluations help identify problems before birth and allow time to plan for safe delivery. After birth, good hygiene practices are critical. Clean umbilical cord care, hand washing, and a clean environment reduce the risk of life-threatening infections. Mothers should seek medical care immediately if the newborn develops fever, difficulty breathing, poor feeding, vomiting, or unusual lethargy. Waiting can be dangerous. Perhaps most importantly, parents must become strong advocates for their babies. Asking questions, insisting on proper evaluation, and seeking help when something doesn't feel right are not acts of defiance, they are acts of protection. While families cannot fix broken systems on their own, informed and proactive families can significantly improve outcomes. When parents combine vigilance, timely care seeking, and advocacy with available medical services, many newborn lives can be saved, even in the most challenging environments.
Can you share an example of what it feels like and what difference it truly makes when a sick newborn is cared for in a facility with an acceptable standard of care?
The difference is profound, and it stays with you. I've attended deliveries where a baby was born not breathing because secretions blocked the airway. In those moments, seconds matter. In a well-prepared facility, the response is immediate. The airway is suctioned, the baby is dried and warmed, and ventilation is started right away. I've watched babies who looked lifeless at birth begin to breathe, cry, and regain color within minutes. Those babies went home healthy with their families days later. I've also cared for premature infants whose lungs were not yet ready to function on their own. With brief respiratory support, careful warming, and monitoring in a protected environment, sometimes just a short stay in an incubator or isolation unit, those babies stabilized, gained strength, and survived. These interventions may sound simple, but they are absolutely life-saving. What's heartbreaking is knowing that in some hospitals, babies in the exact same situations die. Not because their conditions are untreatable, but because the necessary equipment, preparation, or trained personnel are not available. No suction device, no ventilation bag, no warm environment, no trained hands ready to act. The difference is not luck. It is preparation and resources. It is having basic equipment ready, staff trained to use it, and systems in place to respond immediately. When those elements exist, lives are saved. When they don't, babies are lost, needlessly. That contrast is why standards of care matter so deeply. Every newborn deserves a fighting chance at life, and that chance depends largely on whether the facility is prepared to act in the critical first minutes after birth.
What's your final message to families about how to guard against newborn illness and prevent babies from dying after birth?
Babies are not supposed to die, and yet too often they do, many times for reasons that are preventable. Newborn deaths are rarely the result of a single factor. Maternal health before and during pregnancy, infections, lack of oxygen at birth, prematurity, and certain genetic conditions all play a role. What makes these losses especially painful is that many can be prevented through proper surveillance, preparation, and timely medical care. Families should seek early and consistent prenatal care, ask questions, and advocate for quality delivery services. Deliveries should take place in facilities that are prepared, facilities with trained staff, basic resuscitation equipment, infection prevention practices, and systems to respond quickly when something goes wrong. Parents should never feel powerless. Asking for monitoring, insisting on clean and safe care, and seeking immediate help when a newborn shows signs of illness are acts of protection, not inconvenience. At the same time, hospitals and health systems must be held accountable for providing the basic standards of care that every mother and baby deserve. Every baby deserves the chance to breathe, to be held, to grow, and to thrive. Preventing newborn deaths is not only possible, it is achievable when families, healthcare providers, and societies commit to protecting life at its most vulnerable moment. Thank you for joining me on Call with Dr. Anselm and Joha. If this episode resonated with you, please share it with friends and families, especially those who are expecting a child. Until next time, stay informed, stay compassionate, and keep advocating for the health and survival of our newborns.